Hello, everyone. I am Cassidy Avila with the Center for Optimizing Rural Health at Texas A&M University. Thank you for joining us today. Our webinar topic is Marketing Your Hospital, presented by McCabe Message Partners. But before we begin, I would like to make just a couple of housekeeping notes. We are all set to mute and will be during the presentation, but there will be time at the end for Q&A. If you would like to go ahead and enter your question into the chat, you may do so at any time, and we will make sure that it gets addressed during Q&A. If you would like to ask a question anonymously, you may select my name, Cassidy Avila, from the drop-down box in chat, and I would be happy to ask a question on your behalf. So now I would like to introduce the team from McCabe Message Partners. I'm going to start with Paul. Paul Skowronek understands the opportunities and risks that emerge at the intersection of policy, politics, and business, and develops creative, stakeholder-driven solutions. Having previously worked in global communications consultancies and national healthcare trade associations, he is a trusted partner of C-suite executives on issues requiring businesses and policy intelligence, issue crisis, and reputational management, positioning and partnership development, and media strategy. Active in nearly every major health policy debate during the last 20 years, Paul conceived and directed numerous initiatives to help coalitions, industries, and corporations make a compelling case at pivotal movements. Notably, he collaborated with the national health insurers and employer groups to educate policymakers, thought leaders, and the media about key issues involving costs, coverage, and quality during the national policy debate leading up to the passage of the Affordable Care Act and its early implementation. And Paul is the Senior Vice President of McCabe Message Partner. Welcome, Paul. We also have with us today Jennifer Chu, Vice President of McCabe Message Partners. And Jennifer is a creative problem solver and an information junkie. When you put those two skills together, you have a communications pro who enjoys developing research-informed communications that consistently reach the right audiences with the right tactics. She's been a member of the team since 2015, having spent most of her career at PR firms, both big and small. Jennifer has extensive experience communicating a wide range of health topics: cancer, cardiovascular disease, women's health, adult immunization, to audiences ranging from school children to older adults, from lay health workers to gynecologic oncologists. She currently leads a comprehensive communication strategy to support pride and professionalism among nurses. Welcome, Jennifer. And also with us is Sarah Schmidt, Senior Account Manager at McCabe Message Partner. A perceptive problem solver. Sarah helps clients identify goals and fashion tactics that meet them. She translates information into effective messages and devises creative approaches that break through the fray. Sarah has worked extensively with nonprofits, including children's hospitals, public health foundations, and hunger relief organizations, helping them raise funds, execute events, and secure media coverage for their causes. Since joining McCabe Message Partners, she has put her experience to work increasing awareness of the crucial role of clinical trials in ending disease, elevating the role of nurses throughout the health system, and educating patients about potential medical harm. So welcome, Sarah, and I will hand it over to you guys now. Thank you so much for joining us today.
Great. Thank you, everyone. And thank you, Cassidy, for that wonderful introduction. My name is Jennifer Chu, and as Cassidy promised, we do plan to leave time for Q&A and for some discussion. So it's really nice to see the core team around the Zoom screen. Cassidy did such a wonderful introduction. I'm not going to go too deep into who we are, but just for context, Paul and Sarah and I worked with the Centers for Optimizing Rural Health for the last, I think it was like 2.5 years. We started working before COVID, and then of course COVID came along, and we supported the year 2 and year 3 hospitals as well as the center itself. We're really glad to be back talking with you all. In addition to all that is in my bio, in the last 1.5 years, I've also done a lot of work in COVID-19, both working with the providers, pharmacists, infectious disease specialists who are deep in the trenches of COVID, but also helping hospitals like you figure out how to navigate this new COVID landscape. Let me just ask Paul to add a few words before we go back to the agenda.
Thanks, Jen, and I promise I won't add too many words given the great introduction, but I have more than 20 years of experience in health policy communication primarily. I also work heavily in strategic research in order to inform messaging. And of course, my background is largely working with insurers, as well as hospitals, as well as physician organizations, and sort of have seen the entire healthcare continuum from a communications standpoint, one way or another, for the past 20 years. And now let me turn it over to my colleague, Sarah Schmidt, to see if she has anything to add.
Thanks, Paul. I will similarly keep it brief. But for the past 2 years or so, especially since the pandemic has hit, a lot of our focus at McCabe and myself personally has been working with hospitals, providers, and other groups on telling their message in a way that will make it stick, that will make it resonate with their audiences. And of course, identifying who those audiences are and how to achieve their goals. So you'll see a lot of that come into play in the session today, and we're really excited to talk to you all.
Great. Thanks, Sarah. Thanks, Paul. So today we're going to start off with just a little bit of what we call marketing communications considerations. And then we'll talk a bit about trust and how to build it and the role that trust plays in powerful communications. And then we'll share with you a marketing communications framework, sort of the elements of a plan or things to consider. Now, I know that probably around the table, we have some different levels of marketing familiarity, different levels of expertise, as well as different size hospitals and resources. So we recognize that some of what we say may seem too general to you. Some of it may seem too specific for you. So we welcome all questions at the end of this session. And of course, if you have any follow-ups, you can reach us through Cassidy and the team at the Center for Optimizing Rural Health. So that was actually a nice preface to tee up my first slide, which is when we think about marketing and communication solutions, it really is not one size fits all. Sometimes we get asked the question like, should I put out Facebook ads? Well, I don't have a yes or no answer for you. Instead, I'll turn around and probably ask you 3 or 4 more questions before we answer that. Or someone may say, well, I really need to put together a TV ad. Does that work? I don't know the answer to that, because it really depends on your hospital's capabilities, your resources, what your goals are, what your messages are, and we're going to talk about all of these things. But it also depends on who you're trying to reach and what you're trying to accomplish and what your community is like. And we'll talk about all those things too. So it's really just not a one size fits all silver bullet kind of approach. The other thing I want to highlight is that there are going to be some challenges, some problems that marketing or communications alone cannot solve. You could put the best ad in the world out there, but that is not going to solve the problem that, for instance, your town has a declining population. It's not going to solve the problem that the hospital building is falling apart and people don't feel safe going in there. Marketing communications can do a lot of things, but it can't correct for or solve some fundamental organizational issues that probably require a more deep-seated, a deeper dive into solving those problems. So I kind of referenced this a little bit, but in thinking about what's effective when it comes to marketing, where your sweet spot might be, really think about what your hospital's goals are from an organizational business development perspective. Is your goal to market a new service line? Is your goal that you really need to, perhaps it's to build trust in the community? Is your goal a certain amount of revenue? That's sort of what the hospital can control and sort of what the hospital sort of looks internally as their goal. But remember that your hospital is in a community. And so on the other side of the table is what the community needs. You know, do they need a cardiac wing? Do they need additional assisted living beds? What is it that the community needs? Does the community need a consistent presence of leaders in the community to help them trust a new organization? Does the community, are there a lot of children? Is a school-based clinic or some sort of family-based outreach more important? So think about what the community needs, what your hospital is trying to do, and where the two meet. And that's probably where marketing can be the most effective and actually do the most good to serve both your goals and meet the needs of your community. When you're thinking about marketing solutions, whether it's advertising or it's a speaker's tour for the CEO, or it's having a social media presence, or it's, coming up with a 5th anniversary event plan, you really need to think about sort of the hospital's own strengths and resources. Understandably so, marketing is not necessarily the first priority for most hospitals, because patient care is, revenue is, but, it's not going to be feasible, or we would not recommend that you stage, a giant gala if your marketing team is half of one person. We're not going to say you should go ahead and do weekly Facebook Lives if there's no one in your hospital that is familiar with it or has the bandwidth to do the sort of weekly maintenance and upkeep. So really think about the strengths and resources. We talked about the community around the hospital. If you are in a community where there is no radio station, then you don't need radio ads or radio public service announcements. Or if you're in a community that is pretty remote and rural and internet access is not something that's widespread, then there's really no need to have a Facebook Live. That's not going to reach the people you want to reach. The third thing is just thinking about capacity for change. And that's really sort of an internal question for leadership, for your decision makers at your hospital, is how much do you want to do some of these things and change? I think oftentimes people come in and say, we really need to fix this. We really need to right the ship. So we're going to do all these things that we've never done before. But maybe that doesn't quite fit your hospital. Maybe that's not what the hospital wants. Maybe the change doesn't come from your entire communications persona, but some other organizational issues that need to be addressed first. So these are just some things to keep in mind and some questions to have in your head. These might also be questions that, if your CEO, if your leaders came to you and said, well, we need, a digital marketing plan, you may want to sort of okay, let's think about that. Let's think about whether or not that makes sense for us and for the community around us. I'm going to turn it over to Paul to talk a little bit more about the building blocks of trust.
Thanks, Jennifer. And what I wanted to do in the next 4 slides is just spend a little bit of time thinking through this idea of building trust as a way to achieve marketing excellence. If you really think about it, and if you dissect what goes into a great marketing communications program that's highly executable, that's highly effective, and that really helps achieve an organization's goals, either at the hospital and health system level, or frankly, anywhere in marketing, one of the most important factors that goes into marketing success is building trust. There are other factors as well. It might be the credibility of the spokesperson. It might be the impact of the message. It might be the receptivity of the community with respect to the message. So there are a number of factors that go into overall marketing success, but we would argue that building trust is one of the most important, because after all, when you build that trust and when you build that credibility, people tend to listen and people tend to absorb marketing messages a little bit more so than they would if that trust had not been established sort of within your community, within your service area. So we wanted to spend a little bit of time today on what we're calling the building blocks of trust. And as you can see from this sort of setup slide, there are a number of components that go into that sort of make that up. Firstly, what people hear and what people think. Secondly, environmental forces and factors. And thirdly, what the hospital says and what the hospital does, some of the things that are directly within the hospital's control. And if we advance the slides, we'll sort of look at these in more detail one at a time. Firstly, with respect to what people hear and think, this is all about people's perceptions of the hospital or health system, people's personal experiences with the hospital, secondhand information about the hospital. And one of the reasons why we felt it was important to sort of bullet some of these factors out with respect to all of these building blocks of trust and all of these various factors that go into that is to help everyone begin to think about these issues, to be able to allow you and your organization to sort of take a check to each of these, to say, well, you know, when we think about people's perceptions of our institution, when we think about what we hear about people's personal experiences, when we use feedback forms and when we try to survey people on their experience, when we sort of understand what people might hear secondhand about the hospital because we live in this community, you know, we want to sort of get all of this down on paper and sort of dissect these one-on-one in order to hopefully give everyone an incentive and some motivation to really take the time to consider these. I would argue that the more your institution scores well on all of the factors that we're about to run through, the higher the likelihood that there is a strong level and degree of trust between the institution and its representatives and spokespeople and members of the community. And ultimately, that's what it's all about. It's all about serving your local community. And so being able to command the trust of that community is, again, one factor that sort of goes into marketing success. It's not the only factor, but it's a really important one. Because at the end of the day, you know, we're in the business of serving people. And when people feel good and when their perceptions are strong, things tend to work out better in marketing, and marketing messages tend to be a lot more easy. So if we go to the next slide, we also want to consider the environmental forces that are at play. So these are challenges that are faced by the hospital given the environment in a local community. This could be a COVID-induced challenge, like many hospitals and health systems, unfortunately, around the country continue to experience, whether that be you know, a limited amount of services, only essential services that can take place given the COVID crisis, and frankly, not being able to sort of not being able to pursue you know, other voluntary services. Those are obviously very big environmental forces that are coming into play that are challenging hospitals right now. External validation of the hospital by other organizations around the community, by community leaders. That's obviously a key environmental force and factor as well. And then circumstances beyond the hospital's control, going back to challenges beyond the hospital's control, COVID-19. It could be a natural disaster. Last year, very tragically, in the middle of the COVID-19 pandemic, you had people in the Nashville area experience a series of severe weather events and tornadoes. We've seen major flooding this year. We've seen, obviously, issues in California with respect to fires. And so our natural environment and climate also is contributing to circumstances beyond a hospital's control. And again, you know, an institution's ability to respond to this sort of confluence of events, it all goes into forming perceptions, and it all goes into ultimately building individuals' trust and the community's trust in the institution. And then finally, if we move to the next slide, what the hospital or health system says and does, this is obviously a critical sort of bucket of components that can either help build or hinder trust as well. You obviously have a lot of tools at your disposal as marketers. And the first one of those tools that I think is one of the most powerful is messaging directly from the hospital. Only you have the ability to sort of develop the messages that you ultimately want your community to hear and to understand and to be comfortable with. And so the ways in which you are messaging, is that messaging credible? Has that messaging been well received? Is it realistic? And is it something that we think will engender trust? You know, those are all important questions to ask. Even more importantly, though, frankly, is taking actions that align with the messaging. So this is sort of walking the walk. Does the hospital, in the eyes of the community, walk the walk with respect to what they are saying and then what they are doing? If there's disconnect between what institutions are claiming and saying and what institutions are doing, for the most part, people are pretty smart. People can pick up on that. And that's something that could engender mistrust as opposed to building trust. Visibility by hospital leaders in the community. You as an institution have the power to work with your leadership team, to work with key clinical leaders and members of staff in ways that can be constructive in proactively engaging community members, community organizations in order to build trust. On the flip side of the coin, there are some institutions that perhaps do not engage directly with the community in meaningful ways or in enough meaningful ways. And you see time and time again those situations where the community doesn't trust the institution, and that's a recipe for marketing challenges and potential marketing disaster. So a key question to ask as well as you're going through all of these factors that build trust or that could hinder trust if not addressed is, how do we use our board of directors? How do we leverage the strengths of our executive leadership team with institutions and individuals throughout the community? That's a key aspect of any marketing communications strategy and plan, and something that's super, super important. And then finally, relationships with other stakeholders, the payers that you collaborate with, the public health departments you work with, community leaders and others. Again, if those relationships are strong, if those organizations sort of understand where the hospital is coming from, why the hospital is making certain decisions, how those institutions are brought in around various decisions, those are all signs of sort of trusting relationships and relationships that help engender trust amongst those institutions. That can again be very important when thinking through sort of the overall marketing strategy and the ability to be impactful. If those relationships for whatever reason are not as strong, that's another area and a potential red flag and warning sign to think through, how do we build better relationships with these partners in support of our mission, in support of patient care in the community. Now I want to switch gears for another second, now that we've gone through some of the elements of building trust and the importance of that to your marketing program. And I'm going to turn this over to Sarah now, who's going to begin getting into the nuts and bolts when it comes to putting together a marketing communications plan. Sarah?
Thanks, Paul. So we wanted to spend some time today talking about, as Paul said, the nuts and bolts of a communications and marketing plan, because marketing and communications can be daunting, because it can be hard to determine where to begin and how to best utilize limited time or limited resources in the best possible way. So we wanted to give you this framework today to work your communications around. And we do this when we work with any of our clients, whether it's hospitals like you, health organizations like CORE, or nonprofits and associations. We always start by focusing the team on the communications plan because it helps organize your content in a strategic way. So the first step in any strategic communications plan or marketing plan is to define your goals. You first need to understand where your organization wants to go, because that becomes your target. And that's where the goal setting comes in, because your communications plan becomes your roadmap for how to get to that target. Then it's important to consider your strengths. Paul touched on this too. And then who you need to influence, how to tell your story, and measuring the results. And we'll get into each of these specifically. The first one being identifying goals. So when thinking about the goals of your organization, it's important to think about the big picture strategic business goals. They shouldn't just be communications goals. Your communications should support your overall business goals. It touches back to that Venn diagram that Jen pointed out earlier. So does your hospital want to retain current staff? Do you want to increase the use of a new service line among community members? Is your big picture goal to improve your reputation in the community? It's important to think about the big picture, and at the end of the day, remember your hospital's mission, which for all of us, I would say that the hospital exists to serve the community around you. So you should factor that into your goal planning. And then it's important to think about how communications and marketing can help you achieve that goal. This ensures that all of your tactics, all of your messages are grounded in that strategy and all working towards the same goal. It's important to be realistic and specific about that goal, and to determine if that goal is measurable so you can track results, as well as defining a time frame. So can you realistically complete this goal given the time and the resources that you have? And next, we'll talk about looking at your strategic advantages. Again, this is something that Paul started to touch on, but what's best to start with is focusing on what the assets that your hospital already has and what your strengths already are. Think about what sets your organization apart, what you do well, what you're known for doing well in your community. You could think about this in terms of the services you provide, from the feedback that you get from patients or families, or how your employees feel about working at your hospital. Also think about this in terms of trust, as Paul was saying. What are the trusted relationships that you've already built up over time, internally or externally, that you could consider strengths and that you could leverage in your communications? You can distill it down to individuals. Are there people within your staff who are trusted? Maybe it's a CNO who's extremely active at local community events and their face brings recognition to your hospital, or the CEO is from the community and has deep roots and deep ties to your location. Think about who is trusted in your community and how you can leverage those strengths when talking about your hospital and trying to achieve your organizational goals. Now we need to talk about who we are trying to reach. So this is your audiences. With those goals and strategic advantages identified, who do you need to talk to in order to achieve your goals? The key here is to be really, really specific. We often hear organizations say that they want to reach the public, but who in the public? It can't just be everyone in the community. Who is the main group that you need to move or communicate to in order to achieve your goals? Maybe it's older adults, maybe it's nurses or staff, depending on your goal. It can be internal audiences or external audiences. And then when thinking about those audiences, what is their perception or relationship to you? In most cases, especially if we're talking about external audiences, they will have preconceived impressions or personal or even secondhand experiences with your hospital. So they'll have some ideas in their minds already. For most people, healthcare is extremely, extremely personal. So they take those experiences and they internalize them. Most people don't care about policy or regulations. They want to know how your hospital will help them and how it will improve their health. So think about that when you're communicating to your audiences. And then finally, the all critical question, what is the best way to reach your audiences? This gets into the channels and the tactics that you might use to distribute your messages. Are there influencers or gatekeepers that can help you reach them? We often think about media outlets like TV or radio as ways to reach our community members. Social media could come into play here. It's important to think about who your audience is, how they get their information, and what channels you can use to best get them information about your hospital.
So what Sarah and I are running through is kind of the components of a plan, like she referenced, and typically we're delivering a lot of information in a short amount of time. Typically a planning process that we undergo with clients could take as long as like an entire day to go through each of these things. So please don't feel overwhelmed. It's a lot that we're sharing with you, but we thought these were important foundations that you needed to keep in mind. So we've talked about your who, we've talked about the why or the goal. We've talked about what you do well. And so now this is about the message, and messages, that word can sound a little bit scary. So we like to say, think of it as telling your hospital's story. Think about it, come at it from a position of strength. So going back to your strategic advantages, going back to the principles of trust, think about what sets your organization apart. Think about where you have those trusted relationships. And when you think about a message framework for your hospital or the story of your hospital, an easy way to think about it is sort of this 4-part framework is think about, what is the issue or the problem or the situation in the community that needs a solution. Maybe it's that there are not enough people getting their vaccine boosters. And so that's sort of that, when you think about any story that you hear, that's sort of the lay of the land. And think about a solution. So one solution might be that we need to take vaccines to the people. People need to not worry about taking off work. They need to not worry about how to get to a vaccine. The vaccine needs to come to them. So that perhaps is the proposed solution. And the third pillar is kind of where the hero or your hospital comes in. So what is your solution? What are you uniquely equipped to do? And perhaps it's, this hospital A is going to be launching in-factory vaccination clinics for the local factories, or we're bringing vaccine clinics to the community center, or, at the next car show, there's going to be providers talking to you about vaccines and getting appointments made. So and then the fourth part of this framework is like, what do you want people to do? So you want people to come to the event, you want people to come to the hospital, you want people to call a toll-free line. What is it you want people to do? This is a very sort of basic messaging framework. It's very simple. It's an exercise you could do when you're thinking about, if you're going to do ad copy, you can think about what your ad copy in these steps. If you're doing a flyer or an event invitation, you can kind of think about it in this way. In a more complex way, if you're thinking about talking points for a CEO, or you're thinking about an op-ed, this is still a framework you can use. Sort of, what is the issue? What's the solution? And how is the hospital uniquely equipped to help with this? Perhaps it can be kind of contracted and expanded to fit whatever it is, the communications vehicle that you're using. But like I said, this is a very sort of basic message framework. And developing messages can be a little scary, but if you really just think about it as telling your hospital story and you come at it from a point of view of, okay, like, what do I want to say in the simplest terms? I think it takes away a little bit of the scariness. Sarah referenced one part of the plan is metrics, because, if you think about your goal, you have to be able to measure how well you've progressed towards that goal. How will you know that you've achieved that? I think it's very difficult for an industry that is very focused on dollar amounts and metrics to identify what are strong communications metrics. And I'm here to tell you, and Paul and Sarah, chime in if you disagree, but when it comes to marketing communications, the metrics are difficult because yes, there are things you can measure quantitatively and objectively, like clicks to a website or the number of newspaper stories that have run about you. But there's also sort of an unknown qualitative measurement out there, people's feelings towards you, or maybe you got one story, but 1,000 people read it. So is that one story or is it 1,000 stories? When it comes to measuring communications, yes, those quantitative things are important, but I think qualitative metrics are important too. And that may be things that come out in patient surveys. It may be things that come out sort of, in temperature taking. Like suddenly maybe you notice that, okay, the letters to the editor, to the community paper are not all negative about our hospital. Or like, oh, people come into the lobby and they seem to enjoy being there. So these are sort of important qualitative and kind of almost intangible metrics to look to as well. So we've been doing a lot of talking and would love to turn it over to the group and hear a bit, I don't know if everyone wants to share, but those who feel comfortable sort of share what some of your marketing communications priorities are for the next year. Every time we've talked to people, we always say, like, when COVID is over, and we've been saying that now for a year, I guess, and understandably, maybe COVID's not going to be over, but would love to hear what some of the hospitals on this call are prioritizing or looking to do in the next year.
Well, and going back to Jen's original statement about how there is no sort of one size fits all solution and every hospital is different, we thought one of the ways to begin to think about how do we apply some of the information in this desk to your institution, there's probably no better way than to get a little bit more information and insight into what you're thinking about marketing and communications and where you're struggling and where you see strength. So we'd love to hear a little bit more about what you have on tap, and we'd love to engage in a little bit of conversation if you're willing to share. So thank you so much.
This is Cassidy. If you would like to share, you should be able to unmute yourself, or you can type something into the chat. If you have problems unmuting, just type it in and let me know, and I would be happy to unmute you.
Cassidy, I'm going to stop sharing the screen so that we can all see each other, if that's okay.
Perfect.
Hey, I'm going to bite the bullet and go out on the limb here. My name is Brian Rowland, and I'm the CEO at Stevens Memorial Hospital in Breckenridge, Texas. I've been here about 7 months, and the biggest challenge that we're facing right now, and I'm not going to throw in the other than COVID, because we all have that, is we're stuck within a box in this community. There's no growth. There's no looking at growth going forward. There might be down the road, but right now we have to figure out how to work better within the box that we currently have. And so the strategy that we're looking at putting in place in 2022 is what are our weaknesses that people are telling me in the community and us in the community? Is it billing issues? Is it whatever B, C, D, and E might be, and working within that box? And I think that's the challenge right now for some of these smaller communities where there is no growth, is you literally have a box to work in. And how do you keep the out migration from going? And realistically, all of the stuff that you hit on in these slides pretty much are the things that we're looking at, because there's a hospital 30 miles north of us, 30 miles south of us, but our box in Breckenridge is not getting any bigger.
I think that's a challenge that many rural institutions face, particularly institutions that perhaps are even more isolated than it sounds like, Brian, your own is. You're saying you have institutions 30 miles north, 30 miles south. Depending on where in the country you are, you encounter institutions that don't even have that luxury. So one of the things that comes to mind when I hear you talk about some of the challenges of being able to work in that proverbial box, one of the things that I think about is telemedicine and sort of the innovative use of that. And if there are options to expand that, and not just telemedicine, but teleworking and other ways to think smartly about technology and how that gets integrated into patient care, how that gets integrated into administrative processes. That would be one thing that I would look at that may be able to help increase satisfaction and efficiency without sort of going beyond the confines of the proverbial box. The other thing, of course, is that understanding that, there's no growth right now. You're saying you're not really looking for growth, can't really look for growth right now. The other thing to examine would be, is there the potential for shared services? Is there the potential for partnerships or strategic relationships with other institutions in the general area where you're perhaps able to, work via referrals, work via sort of the relationships with those other institutions that are sort of in stone's throw from your institution? So I think it's a really interesting question. I don't know that there's a super easy answer. But what comes sort of top of mind for me is sort of looking at telework, telemedicine, and the possibilities of how technology may factor into improving efficiency and satisfaction. And then secondly, looking for shared service agreements and other strategic partnerships or relationships with institutions that are in your area. It strikes me that those are a couple of ways to think about how you can try to get out of the box without getting out of the box, if that makes sense.
Something you said also is pretty important. You said, the things that you're hearing from the community, whether they're told to you or told to others in the hospital. So it signals to me that you're doing some audience research, some listening. And I think that's really important. And I think that's a strong and powerful way to build up trust and also kind of help identify what some of your goals within your box could be. So I'm really pleased to, it sounds like if people are telling you directly, that sounds like you and your hospital must have a relationship with the community that's pretty strong.
We do. Yes, thank you.
And I would just add to that, that relationship to the community, you can leverage that as one of your strategic priorities. You mentioned that there's hospitals north and south of you, but that relationship that you have to the community is definitely something that can set you apart from those two other facilities. And continuing to listen to their feedback and use that in your communications planning can be really beneficial in the long term.
Perfect. Thank you very much.
So in the chat, Misty Duncan noted that we were just approved to build a new facility. They'll be adding new services. So a lot of our focus will be on that. That's great. And really focusing on getting a good, solid social media presence. Oh, that's wonderful. I think Sarah and I can make a couple of comments about that. I think what's really important about a good, solid social media presence is having a plan and not feeling like you have to jump into every channel all at once. I think knowing your community and knowing where people are is a good starting point. So maybe you discover that, Facebook is where the community is gathering and talking, or maybe it's Nextdoor, or maybe it's some other platform where people are most active. You don't feel like you have to jump in with Instagram and Twitter and TikTok and Facebook. It's helpful to kind of pick the one that you think your people are and start there. And then there are a lot of, and you may know this already, but there are a lot of great social media tools out there. So that you don't have to feel like, well, someone has to sit at the desk at 11 a.m. to send out this tweet. There's great social media tools out there that let you pre-plan content, that let you measure and engage. And there are some tools that even tell you, like, we're going to auto send, your newsletter on the day that we think they're going to be the most open. So it's really, there's a lot of possibility out there. And a lot of these tools are not expensive. Some are even free. Sarah, I don't know if you have anything else you want to add.
Yeah, thanks, Jennifer. I think the piece about not trying to do too much at first is really important. I think starting off small and perhaps building from there once you see what's working is a good way to begin your social media strategy. Each platform has slightly different audiences that it caters to or that use it. So Facebook might be geared to a slightly older audience. Twitter might be geared to a slightly more media savvy audience. So doing some digging to figure out where your community already is a really efficient way to start your social media strategy. And also I would recommend taking a look at sort of your internal processes for managing that. Set realistic goals about how often you're going to post, who is going to do it on your team. Maybe if you have someone on the staff who is really familiar and comfortable with Twitter, maybe that's where you begin because that's where their strengths lie. So do a bit of an internal assessment too, to see what is most realistic for your hospital to start. And then you can always build on that as you get more comfortable and start to build those profiles.
And we had a raised hand. Forgive me if I'm not pronouncing it correct. Electa, I requested that you unmute. Can you hear me?
Perfect. Yeah, you said it correctly. My name is Electa Waddell. I'm the Marketing and Foundation Director for Hinckley Regional Medical Center in rural South Florida. I would say that for us, COVID was almost a blessing in disguise in the sense that it really was a positive in our reputation management. We really became a leader in the community. While we had always been that as an employer, I think being able to serve our community throughout this with our services and education was really a positive. But I think my question is, how do I continue to capitalize on the positivity that we were able to garner throughout this pandemic and moving forward?
That is a great question. I can start and Paul and Sarah, go ahead and chime in. I think a lot of whatever you've been doing during COVID to help you build that trust in that relationship, if you were having sort of regular CEO updates to the community, or if you established a strong social media presence, or if you were just out in the community, if you were at events or just sort of being very physically present, I think you can continue those sort of avenues, but just start to dip your toe into other key issues that the community cares about when it comes to health, or other strengths that your hospital offers. So maybe it's, pivoting to flu vaccinations, or maybe it's pivoting to, having chronic disease sort of checkup fairs, or just sort of the things that you are doing to help you build that trusted relationship with your community. You keep doing those things, but sort of changing what you're offering them.
Jennifer was sort of reading my mind. What I had written down, what I wanted to add here is essentially keep the communication vehicles in place that you've already built that seem to be working to build goodwill, and then subtly pivot away from COVID toward other subjects. Because it sounds like whatever you have sort of put into action during the time of COVID is resonating, and that's fantastic. That's half the battle. So if you can sort of evaluate what sort of vehicles you have used in order to get to that good result, maintain those vehicles, pivot to different subject matter, as the time allows, I think that's probably a really great starting point. I also think it's really important to continue, and this has been said a couple of times, but to continue to get that community feedback. So understanding that, COVID was a special time. COVID, you may be getting the reactions you're getting because of all of the goodwill that you built around COVID. When there's not COVID, the situation could change. And so it's important to, never sort of take your pulse off of the heartbeat of the community, and ensuring that you continue those close relationships in order, as you said, to perpetuate, good things with respect to reputation. So it sounds like you're doing a lot of the right things during the time of COVID, which is fantastic. It's half the battle. The challenge now is, how do we keep those communications and initiatives in place and make that strategic pivot, while also keeping our pulse on sort of the heartbeat of the community to understand, how we can continue to stay as an institution one step ahead.
Thank you.
Thank you for the question. Okay, and we had another comment in chat. So it reads, we are a small critical access hospital looking to pull market share away from a large system hospital 30 minutes from us. Looking for the differentiator. Any thoughts?
I think certainly the differentiator could be that you're providing more of the personalized service so that everyone, who's admitted, anyone who's coming for an outpatient procedure, that they're not a number. A lot of the time in healthcare today, people talk about the corporatization of healthcare. They talk about that with respect to hospitals. They talk about that with respect to payers. And it's a real challenge. A lot of the time with corporatization comes less time with patients, less personalized care, less understanding of the procedure that's happening, less follow-up. Sort of if you think about the continuum of patient care, going from diagnosis right through sort of the end of the episode or the end of the procedure, there are a ton of opportunities to communicate and to engender trust and goodwill amongst the patients that are being seen. And so certainly from the standpoint of being a regional player and not being sort of the large system hospital on the block, certainly you can talk about the benefits of convenience, the benefits of community, the benefits of more personalized service and care. And it strikes me that that would be a starting point.
Yeah, and that's actually Paul was reading my mind this time. That's what core hospitals, that one of the benefits is the fact that you are close to home, and maybe the provider, the nurse who is taking care of patients is also someone that patient goes to church with or sees at the grocery store. There's a different there's a personal connection there that might not be available at a large system hospital. So it's definitely a differentiator that you could tap into. And I would also say, looking at your services and your service lines, if there are any differentiators in that fashion that you can start to highlight, that sort of set you apart from the larger hospitals, that you can again highlight are closer to home and within reach.
Thank you. And we had another comment in the chat that reads, what strategies or ideas for rural provider recruitment do you have, considering burnout, provider shortage, travel distance for specialist care, and/or ancillary services for patients?
I feel like that's a question every industry is asking. I'm sure many of you seen the think pieces in the last month or so about what they're calling the Great Resignation of various industries losing people. And I think it is so much more acute in healthcare because healthcare providers have been on the front lines for so long. And already it was a high stress profession. And I think the pandemic has just exacerbated it. Not knowing where your hospital are, I think what we've heard this from previous core hospitals. I think it was some of the year 2 and year 1 hospitals where they kind of emphasized and made being a rural, having rural geography as being a selling point, whether that meant more room and space outdoors, being closer to national parks, or sort of a break from that sort of high stress suburban and urban lifestyle, regardless of the job. That quite a few people have used that to their advantage. I think another thing to think about is what would a trailing spouse do? So thinking about in your community, what are the other industries besides the hospital that are available? What other opportunities are there for the spouse that's following the provider? I think making sure that that's part of your recruitment and part of your sort of job advertising is important. Last year, when we were talking to some hospitals, we talked about the use of social media also as a way to promote hospital culture as a recruitment tool. So if your current employees love where they work and there's a family and a community in your hospital, promote that. Promote what a caring group it is, how much of a community it feels like, the great things that your hospital does. Sort of put that face, because a hospital isn't just a building, it's the people that work in there as well. But make that part of your recruitment pitch of, look at what you can join. You're not just joining a company, but you're joining a community. I think that those would be important things to think about.
I think that's all really well said. I don't have anything to add other than this is a really tough moment for labor and employment in the US across industries, particularly in healthcare industries. And so everyone is asking this very same question. And this is something that we think about a lot. It strikes me that, there are many people that are offering incentive bonuses and that sort of thing. It feels like that's just one piece of the puzzle. It feels like if there is to be a more lasting impact, it really does have to hit squarely on this idea of lifestyle and community and a broader set of advantages than just the compensation or an initial bonus.
I don't see anything else in the chat, but we did have a kind of a question or comment in the questions at registration, and that individual was looking for some feedback on creating stronger face-to-face involvement with community at local events.
I think I would recommend 2 things. One is, host your own, but also show up at other events. So if the Chamber of Commerce hosts something, see if the hospital can get, a booth, a slot on the speakers program, or just sort of be seen. If the PTA is holding a school fair or something, could the hospital sponsor a table? Could the hospital sponsor a raffle? Sort of be seen in other organizations' events and have a presence that way. My other question back to the hospital would be, what's the face-to-face interaction like now? Is it, not strong enough, or is it strong? You just want to make it better? And think about who has the most success in the community. I know that last year we worked with a hospital where I think it was an EMT that was affiliated with the hospital, was very well known in the community. He was Santa Claus. He was just known. And so any kind of event that they had, they always brought this person because everyone in town knew this person. And he became associated with the face of the hospital. And then, they sort of use him as the kind of star billing, and then always had a rotating supporting cast around him that gave everyone a chance to start building relationships with the hospital while taking advantage of what was sort of their strategic advantage, which was a powerful personality. But the other thing I would also say, going back to strategic advantages, is if you have folks in your hospital who like to do face-to-face things, who like to be out in the community, who like to participate, tap into them. Don't take someone who isn't great at it and doesn't love it, but feels like they have to, because you're going to lose some authenticity there and some expertise there.
Excellent. Thank you, Jennifer. Okay, so we don't have anything else in the chat right now, and we are coming up on 1 o'clock. So I think we'll go ahead and wrap up. But if you have a question and you just didn't quite get it into the chat, please don't hesitate to send us an email and we will do our best to get it answered for you. We will be sharing the slides, and you should get an email tomorrow with the recording to the link and a link to download the slides. And we appreciate your time, and we're so happy that you joined us today. And I want to thank Jennifer and Paul and Sarah. That was an excellent presentation, and we appreciate your time as well. Thanks, everyone. Have a great afternoon.
Thanks, everybody.
Bye, thank you.
Thank you.